why do you think mothers and parents aren't taken more seriously? Because this happens a lot. I can't even begin to tell you how many stories. I mean, I've known literally thousands and thousands of families over the years, and they tell me stories of how they were treated, plus family, friends, and such. And of course, it doesn't happen all the time. Of course, there are some awesome and wonderful OBs and midwives out there, and probably you're the ones who are watching this video and thinking hard about what else you can do to be supportive and help these babies be okay, and listen to these advocating mamas. It's often the ones who really need it that don't take this time and attention, but maybe you can help spread the word. So some of our thoughts about why mothers aren't taken more seriously. It's clear to me it's not evidence-based, but is absolutely empirically based. I can tell you for sure that there are plenty of providers and others who believe that preborn babies are different than a newborn. It's almost as if they're less significant or less respected. When that baby is out, I mean, we've got teams of people, and we've got the NICU, and we're testing, although not in a couple of these mamas' cases that you've heard today, but more likely than not. But continuing on, mothers aren't taken as seriously when they have concerns until their baby is born and older. That happens quite a bit. Too many providers believe that, some babies die and they don't see the need for investigation of a cause, which might unconsciously influence their care. What do you think? Is it possible that the level of concern is not a 100%? Is it possible that it could be less because of one's belief system? I don't know. I'm just putting it out there as a possibility. And some believers just generally believe that all will be well. Don't worry so much. You'll create your own problems. You make yourself superstitious. Things will happen. And women have been having babies forever without problems. Women have been having babies forever, but absolutely with problems. We cannot assume that all will be well. That seems to me to be a bit unethical when you think about it. Well, you're having a heart attack. Well, most people have come out of it okay, so I think you'll be fine. Don't worry so much, or you're going to make it worse. We don't treat people like that in other situations. Why do we do that? Especially when they're pregnant and they have some issues going on, some concerns. Why else? Some providers believe they know best, and they don't take into account that mother might know best about some things, that mother and partner's view, needs, wishes, and fears are real and need to be dealt with, not swept under the carpet, not dismissed, but rather respected. Some have an attitude of, well, what can we do about it anyway? That 17-weeker we talked about, little Elijah, what could we have done anyway? Well, I guess we'll never know, will we? But what if they could have tried to stop labor? Or what if they could have investigated further to find out if she had an incompetent cervix, or if it really, tested her for GBS again, looked at the potential of how her placenta was looking, done a blood flow test to see if there were any problems. If you are of the belief that every baby matters, then why leave it up to chance? And yes, even 17-weekers. And I think there's a reliance on ACOG and March of Dimes and others who set standards of care that promote this later delivery, sometimes, often, in many cases, always, with certain hospitals, doctors, communities, up to 41.5 weeks before an induction, or most inductions are allowed. And they can't or don't make decisions based on the individual, except in limited number of situations, the ones that are reported as allowable by ACOG and March of Dimes and others. Also, some parents believe that the doctors and midwives know best, that they know their baby better than mama does, that they know mama better than mama does. It worries me. That's a bit of a dangerous thing to believe. Because we're not widgets, and no one can know what's going on inside there unless they look, unless they investigate. So this belief by parents might be one of the reasons that they do not take more control and responsibility for their own care. Many parents, mothers especially, but partners too, are in shock and high stress when they think something is wrong, and they might find it difficult to impossible to self-advocate. They may not trust their instincts. They want to be a good patient. A good patient doesn't rattle a cage, doesn't challenge a doctor, doesn't ask the doctor to repeat 3 times what they're saying because that parent doesn't understand. That's going too far for a lot of people who give all their power up, if you will, to the provider. Moms feel pressure that they are imagining or overreacting. You heard that in one of the earlier stories. You're just a first-time parent, you're overreacting. That pressure, those words, and that messaging is very damaging. And I just have to ask medical providers, why does that need to be a philosophy? Why does that need to be said? What if 5 people are imagining and 3 are not imagining, and those 3 babies don't make it or have some lifelong chronic problems because we didn't investigate, because we assumed that they were all imagining and overreacting. It's just not. It's not right. If all cars are looked at, and like when I drive my car and I hear some noises that aren't right, I want to take it in and have them look at it. And if they said, well, other cars like that are just fine, I think you're overreacting. I think you just need to wait and see if something goes wrong. And then I'm on a desert trip in the middle of the night and my car conks out. It's a little late for getting it fixed and being proactive ahead of time. So that pressure to not respect and listen and go to that place of imagining or overreacting is it's not helping the babies, and it's certainly not helping the moms feel assertively empowered and courageous enough to dare speak up the next time. There's common messaging from providers in the childbirth world that nothing can and nothing does go wrong, or rarely happens, so just don't overreact. If you look around and you read and you hear what people are saying and you attend seminars, this messaging is pretty pervasive right now. Parents don't know who to call for support or for an advocate or to consult with, or they don't know what to do if they're not listened to or taken seriously. They're by themselves. They're vulnerable. They might even be in a gown. Mom might be. Dad is confused. Didn't go to childbirth class. Didn't read those books. Or didn't pay attention. Doesn't have the same level of knowledge that even mom has. Can he stand up for her? People need a sense of who can be supportive, whether it's a doula or a childbirth educator, a baby loss family advisor, a bereavement doula, a patient advocate of some sort, a good friend, a parent. Might be a good idea for us to start encouraging people to have proactive, informed, and educated support people available to them. And mothers can't see inside their womb, they can't see their baby, so they're usually going only on personal feelings and intuition, or those movement counting that hopefully they still do, even though I know that's going out of fashion. We'll talk about that more. When they don't have data, they don't have a thermometer, and the person can't look at the baby's color, well, then what are they going to go on? They need an ultrasound, they need check for infection, maybe they might need a blood flow test. They might need a non-stress test, a heart monitor, to listen to that baby to see if there's anything going on. But most women don't have those tools, although some now are out on smartphones, which as a medical provider, you might not really appreciate, but as a parent, I do appreciate, because when you're without the tools and it's only intuition, and then you get turned away by the hospital or the doctor or the midwife, like so many people have, it's like tying someone's hands behind their back, putting a weight around their waist, and then dropping them into the ocean and say, oh, it's okay, you'll swim just fine. You can tell I have passion about this. I don't apologize, but I hope you understand that I really think there are lots of reasons why mothers are not taking more control and responsibility, and some of it is the messaging they're getting, and some of it is the lack of tools and lack of supportive people who they can consult with who are informed. Why else? Well, they don't know the system, the options. They don't know how to speak to birth professionals unless they're one themselves, or people in authority often. And they don't know what to say or how to say it to gain their respect and be heard, especially if they are, fill in the blanks, low income, immigrants, maybe people of color, young, uneducated. Is it possible that those folks have an even harder time gaining respect and being heard, even if they knew how to advocate for themselves? I'm going to say that a lot of those folks also don't know how to advocate for themselves. So we have a really big problem here that I hope that what we're doing right now, that this video and the website that we'll be creating will help people find the tools, the people, and the resources they need to stand up for themselves. And I hope that medical care providers might take a deep look inside and say, what am I doing? What are my colleagues doing? What is my clinic doing? What is my hospital doing that promotes this kind of advocacy, awareness, and education rather than the opposite? Parents often don't know what is the best, what is the standard of care, what to expect, and how to work within that system. And by the way, the best and the standard of care, that's what is being used, and how to work within that system might not be enough to take care of their baby's needs. It might be that we have to go above and beyond that, but they don't even know the basics unless they work in the field. I think a lot are afraid of so many things, afraid of that this really could be a problem, afraid their baby could end up in the NICU, afraid that they're having a heart attack or their baby might die, afraid that they're going to bleed out, afraid that if they show up no one will listen and they'll look foolish, afraid that their partner will think they're crazy because once again they want to go into urgent care or the ER. There's so many reasons to be afraid, and when someone is afraid, it's often because there's uncertainty. They don't know what they don't know. We can minimize, reduce, cut some of that fear. I don't mean minimize it, but I mean reduce it by helping them gain answers and information. But in a state of fear, people can feel stuck, confused, upset, and unable to make a positive step in the right, take the motion going forward. They might just be stuck in the quicksand of it all. They also might be afraid their provider will drop them if they're too demanding or ask too many questions. And in this day and age where it's hard to find doctors, that's a very real fear. Women tend to shy away from conflict in general, many, and want to be good patients, not rocking the boat. Therefore, they might be less likely to speak up and ask questions, to ask for a different path if they don't agree. This is true for most cultures. Often there's a struggle between mom and the medical staff, with mothers thinking, I'm worried, get my baby out, help me, and medical providers thinking, be careful, you don't want to deliver too early or it will hurt the baby. This brings inherent tension, and one that's hard to balance for a worried mom and for the providers also. What kind of rights do mothers have? The right to change doctors or nurses, to ask for different ones when being cared for in the clinic or hospital. I have met many wonderful, kind-hearted, smart, give fantastic care providers who just didn't click with somebody, and that family really had a terrible experience because of the personality struggles or the way that the conversation was going or the fact that they couldn't understand that doctor or that midwife. And so whether it's real for others or not, if it's real to you, you can ask for a different nurse. You can send someone out and like your partner or your family friend who's in the room with you, or the social worker, and say, I really need a different care provider. Maybe that person was real short with you. They didn't understand that you're in a lot of pain and that you can't get up to go to the bathroom, or that you are so sad and upset that you can't make decisions right now, or you don't want to talk about your baby, or you do want to talk about your baby, and they are taking the opposite position. So whatever the situation is, you have the right to ask for a different medical provider. You have a right, if no one will see you, to go to the emergency room. Let's say you try to get into the clinic and they say, no, don't worry, drink some orange juice and call me in the morning. Or you call the hospital and they're like, oh, there's no beds here, and besides, I'm sure everything is just fine. Come in, call us back tomorrow. We'll see if you should come in. But you can go to the emergency room in any case, and you can expect to be treated and not sent away. And while you're there, it would be a good idea then to ask for someone from labor and delivery or an OB doc to see you, because emergency room doctors don't necessarily get training in miscarriage and stillbirth or in complications of pregnancy. In fact, I have a story that I think I'm going to need to tell as soon as this slide is over, from Dr. Catherine Gold, that occurred where people were not listened to in the ER, and there were some potential problems that occurred. But moving on with mother's rights, to check with the insurance company about how to proceed if there are issues, problems that are serious and not being acted upon. So let's say you have some concerns, Mom, and you don't know if your insurance is going to cover it. Sadly, you don't want that to interfere with your care. So if this is serious, you go get handled and don't worry about insurance. But if you have some time, someone could call your insurance company with your permission. You might have to even be on the line and ask them how you proceed, and ask them to maybe talk with an advocate, or if something is covered, or how much it would cost if you want to pay for it yourself, whatever that case might be. So there are times when that might be appropriate. There are certainly times when that's not appropriate. You have the right to speak up and ask for services, for care that you deem critical. That doesn't mean that they're going to give it to you, but you have the right to ask for it and to push for it, and to have conversations about why it is denied, and then to learn what your other options are. Can you talk to another doctor? Can you someone call the insurance for you? Can you decide to pay it for yourself? Whatever. You have the right to be listened to and to be respected. Yes, you do. Whether you're crying, whether you're emotional, whether you're angry, whether you're upset, whether you're in shock, you do still have that right to be listened to and respected. You have the right to climb the bureaucratic ladder for other answers. So in other words, if you're in the hospital and something is happening and you're not real thrilled, or you're very upset about it, you can ask to talk with a patient advocate if it's during regular hours. You can ask to, maybe your partner can go visit an administrator in the hospital. I might start with the charge nurse, and then the unit manager, and work your way up. You don't want to go above someone's head unless you have reason to go above someone's head, and then you do it. You do what you have to do to save your baby's life, to save mama's life. Using social media and local media. Okay, I'm not a huge fan of this, but I've been asked to put this in the presentation because it's only fair that people need to understand that if you've gone to all lengths and you can't get what you need, or something terrible happened to your child because of the care that you did not receive that you should have received, that was you were failed like Christina was by 5 different levels of care, people and ways that she was failed. If this is a desperate last resort, I have seen people go to the media. They go to their television station, they go to their newspaper, they go to social media, and they start talking. Okay, I hear you medical care providers feeling not very comfortable with this. I totally get it. But if someone has serious, significant, real reasons why they are just getting nowhere, what else are they to do? So be aware that if you choose to go to social media or local media, or higher than that, there might be consequences that will follow such actions. You might find that your doctor says, yeah, you're not my patient anymore. You might find that your friends who are midwives get upset with you, or hey, they might congratulate you. Who really knows? But you do have the right to go public if you feel it is necessary. And I didn't write it down, but of course you also have the right to go to an attorney. And again, it might be the desperate last resort, but if that's something that's on your heart and you feel you need to do it, you have the right to do that. I think this is a good time to talk about Dr. Katie Gould's story about changing the outcome of a really kind of a scary situation. So she was listening to had the Doppler on a mom's belly, and she heard the heartbeat slow down and then come back up to baseline, which was enough for me, I'm going to use her words, to put her on the monitor for a formal tracing. After 20 minutes, she did not have a tracing that was reassuring. So I sent her from my clinic to triage so she could have prolonged monitoring, which is usually 2 hours or so, to get a better sense of what's going on. While in triage, she had more of these slowdowns in the heart rate. This was a full-term pregnancy, and it was a little bit past her due date. If you have a baby that has made it this far and then you have signs the baby isn't doing well, you probably should just go ahead and deliver that baby, not send mom home. But the staff in triage did send her home. I was horrified. I called her the next day and brought her in for induction. She had very low fluid, continued to have non-reassuring fetal heart tones, and thank goodness this was caught in this full-term mom. Her monitoring not being reassuring was troubling Dr. Gould, and so she did not hesitate but decided to deliver her. To their credit, the doctors who sent her home felt terrible and realized they had made a major miscalculation and were able to learn from it. But it really shook me up, having had her own stillbirth and doing everything she can to help people have a healthy baby. She tells another story of a mom in the ER that was almost a tragedy also. I think of a recent case I heard that happened at another hospital, not mine. The mom comes in at 35 weeks, contracting every 2 minutes, and was in excruciating pain. The triage team watched her for a couple of hours, decided she wasn't in labor, sent her home, giving her only Tylenol for the pain, which doesn't do anything for her. So now she's begging for something more, but they ignore this. Medically, a patient contracting every 2 minutes and with that type of pain should be a huge red flag for abruption of the placenta and really needs to be monitored for a prolonged period. Sure enough, mom is discharged and then shows back up at the hospital 6 hours later with red vaginal bleeding and delivers within a few hours, suggesting a likely placental abruption. Baby was in the NICU, not doing well. As a physician, I might not know exactly what is going on, but I do know that something is going on. And when someone is in labor, having contractions every 2 minutes, that doesn't look like a mom begging for pain medication to me. But if you don't believe the mom or don't take her seriously, in this case she is not white, which might or might not have played a role, then you miss serious red flags like these. None of this is meant to point fingers at anyone, but it is meant to empower all of us to take a good look at what that outcome is that we're all seeking. A healthy baby, a healthy mama. And hopefully these stories of love and the missed opportunities and the opportunities that, like in these last 2 cases where babies' lives were saved, are really important stories to take into our heart and our heads. And I would encourage and invite you to, as you think about those stories, think, well, what would I have done if I'm the mother? What would I have done if I'm the medical provider? After 3 decades of teaching nurses and doctors and attending support groups and empowering parents and all the reading and writing that I've done, the 18 books that I have authored, I have come to this conclusion that I want to share this new paradigm, 5 principles of perinatal loss, patient-centered care. I've tweaked them a little bit for the parents, but I have them available. If you want to write to me, my email is at the end of this PowerPoint. I've tweaked them a little for to fit for mothers. Normally, I use them for the care providers. So the first one, it's called SAFER. This is SAFER model. Slow things down and ask them, the staff, whoever you're interacting with, to impart information slowly and intentionally, to give you a chance to respond, to refocus, to review what was just said, to ask questions. If everything is in a rush, and I get it, if it's an emergency, that's a different situation. But if it's a non-emergency, when everything is in a rush, mistakes are often made or can be made. Decisions aren't necessarily the best. People are not usually well informed. Misunderstandings can occur. So let's look at that S and slow things down and impart information intentionally. A, acknowledge and affirm what you hear medical providers saying. And medical providers, it's for you to affirm and acknowledge what the parents are saying. And ask them to hear you, to repeat what they're saying and needing. So did you hear what I said about XYZ? Tell me in your own words what it is that you heard, is a way to identify if they really did hear you. You know, a parent could say, but I'm really confused. Did you hear me say that I feel there's something wrong with my baby? It looks like he's turning gray. He's not eating. He's throwing up. Can you please tell me what you're hearing me say, because I don't feel like anyone is listening to me and I just need to know we're on the same page together. F, ask to be fully informed. Medical care providers, are you fully informing? Are you really telling them what they need to know in order to move forward, to make a decision, to investigate what's going on, to do their homework and their research? Tell them you are not looking for protection. You want to know the entire truth so you can make the best decisions. Sometimes people are not fully informed because others are protecting. They don't want them to be upset with the whole bag of information that might not be so good, or that might be conflicting, or that might be hard to speak about out loud. But if you ask for the entire truth and you say, we're going to handle this, we can handle this, you have to believe you can handle that information. Maybe you ask them, again back to the S, to give it to you in bits and pieces, and to make sure that when you're full up, you're done. I'm done for now. I still want more of the information, but I just can't take any more right now. Can we talk in an hour? Can we see if we can connect up later this evening? Can we talk tomorrow if we can wait till tomorrow? Maybe you can't, so you have to just take a pause and reconvene soon. E, ask for help being empowered and supported rather than being protected and rescued. Many times care providers have a heart of gold and goodwill, and they are trying to protect and rescue their patients. Wouldn't talk to you about taking that baby home who's died after death, because that thought is going to be so painful that I just don't want you to even have to go there. Well, by keeping that information away, have you empowered the parents to make a thoughtful decision? Because maybe that is exactly what they would choose if they felt supported and they knew how to do it. But they didn't get the chance if someone's already rescuing from something. So, I could give many examples, but I think I'll just stop there. That don't protect and rescue. Be a helper, be a supporter, and empower them to make the best decisions that they can. And R, say out loud that you wish to be respected. R is for respect. Say it out loud to yourself. Say it out loud to each other. Say it out loud to every care provider if you feel you're not being respected. And treat it as the parents of a loved and wanted baby. This life matters. Let them know you will fight for it. Once it's over, if something happens, you can't go back and say, I'm going to fight for it now. You can fight in the legal courts. You can fight by teaching others not to have it done that way and trying to change things, but you can't change it with this life unless you're doing it right here, right now. So ask for the respect that you deserve and ask to be treated as the parent of a loved and wanted baby, because this life matters. Part of the way to be treated with respect is to give respect, and that's kind of a basic, but it's not so easy to do, I understand, when we're in the middle of shock. How to self-advocate. I'm going to take a pause and point out that you will hear a few things being repeated during our session with you today. That's really on purpose, because there's so much to cover. And yet there are some very basic things. You've probably already heard the self-respect and the mutual respect. You've probably already heard the trust your instincts more than once. And you're probably going to hear them again, because those are some of the basics that will help you work through this process, work through this journey in a more positive and effective manner. Early on in your pregnancy or before, find a provider who clearly listens to you and will work with you. You heard Christina talk about that. Rather than having everything his or her way, I don't mean it to say like they are trying to take all the power, but there are some people who really are experienced and do know what works for most people, but they might not know what works for you. And so if there's an openness to hearing what your needs are, and especially if you've had an unexpected outcome before, you're probably going to be more assertive and strong this time to get what you need and to be listened to. But building trust and mutual respect will help for your ongoing care. If an unexpected outcome arises, you'll probably feel more comfortable and respected in this type of relationship. You know what? Ask a lot of questions. You're not expected to know the answers. You're not expected to know what that medical term means. And doctors and midwives and nurses sometimes can't help themselves. They have an acronym and you don't know what that acronym is. So please, tell yourself from early on, I'm going to ask a lot of questions and I'm going to ask for clarification. Before I make decisions, before I go home, before I leave this phone call. And when you don't understand, that's your moment. Take a pause. You're not alone in this. Say something like, let me see if I heard what you said. You suggest that we do such and such. Is that what you're saying? That's a good way to follow up and get clarification. Highly encourage you to seek second or third opinions when it's serious and you need more information. All doctors and midwives understand that they probably even seek second and third opinions. So don't feel like you're going to hurt their feelings. They're big boys, big girls, they can handle it. And if they can't, then maybe they're not the right medical provider for you. But second and third opinions can help make things more clear for you. Maybe someone speaks more of your language or explains it in a way that makes more sense to you or to your people who are with you. Other ways to self-advocate. Believe you do know your baby best. No one else has been with him or her 24/7 like you, Mom. Your provider may be wise and educated, but they do not love your baby like you do. You may need to fight for the care that's needed, in your opinion. Are you up for it? Hopefully by the end of this you'll have some strength that seeps into your mind and your heart and your veins, and you'll have more information, you'll have some resources, and you'll have some ideas about how to do it. And medical providers, please know that when we are encouraging people to self-advocate, hopefully you agree, that hopefully you know that we respect and, generally speaking, trust you, but don't always agree with you, or maybe need more information, or want to go a different way. Hopefully you don't take it personally and you understand that these folks need to fight if they have to fight, because if not them, then who? Keep mutual respect and kindness and love in your heart when acting as a mother or a father, a partner, by protecting and advocating for your baby with providers. Providers will likely help you more than if you're angry and demanding. Respect, kindness, and love. Sometimes I'll say, please know that when I say this, I'm speaking from a loving heart. I want to share this maybe not very easy thing with you. And it might even be a criticism. It might even be a suggestion for improvement, but it's coming from my heart with good spirit attached. Find an advocate who can work with you and your partner. if you have one, so that you have outside help if things get too emotional. It could be any one of these kinds of people. It could be a social worker. It could be your family member. Could be an attorney friend if you're feeling like you're having to fight some battles that might end up being legal. Can't tell you who that person is, but if you really think about it, you will find that person or two or three. What to do? I'd like to give an example that might help you to have a little bit of something to compare to when you talk to doctors, midwives. Let's say you have an infant who's listless, rarely moving, though was usually very, very active. Mom feels something is not right. You call the medical provider or the nurse line, and they ask you for a description of the problem. What's the temperature? Are there any signs or that there are change or anything worrisome? And usually, most people tell me that when they have an infant who's got a fever or who's very listless or who's been down and out for a while here, they'll usually say, come in, we'll examine the child. They'll take the heart rate, the temperature, they'll look at activity, limpness. They might run tests if it looks concerning. They can see. They can tell you to bring in that child. And what if it is life or death? It's important that you bring that child in and they see and they look, examine, investigate, and test. But let's think about a preborn baby. The baby's been active, but the movements have changed. Yes, there's still some movement, but they might be less or they might be more or a combination thereof. Mom feels that something is not right, just like with the infant who's newborn, whatever, or 10-month-old. What will the medical providers do? They'll ask for a description, any signs that have changed or are worrisome. And then many will say, well, drink some orange juice or wait for a few hours or come in tomorrow, then call back or wait till I see you at your next appointment. I'm sure everything will be okay. And there's this delay, but it's not medically supported in solving any problems, or none of those things really help the baby. So what can mom do? Because if you look at the two of these, they're being treated really very differently, and yet the same kind of thing is happening. So I'd like to suggest that you take this seriously, even if it seems serious to you or just worrisome. So you get to decide if you're worried and it seems serious, then act like this is a 10-month-old infant and that you're bringing your baby in and that something can possibly be done to help the baby. Go in immediately if concerned. Don't ask permission. Indeed, what if this could be a life or death situation? What does staying home for a couple of hours or coming in the morning or waiting until the next appointment do to solve any potential problem or to have the discussion about, do we want to deliver this baby early?